Hi, this is Vinayak from Education Vibes. Today we are in Geomedi Technical University. Uh, Nitya is with me.
Hello.
Hi Nitya, how are you?
I'm good. How are you?
So you are studying over here?
Yes, I am. I'm a fourth year medical student here and the founder and president of the academic club, Students Academic Society of our university.
So today we want to discuss the classroom and want to see the labs and examination center. So are you ready to?
Absolutely. I'll take you around.
Okay, let's start.
Yes. So these are the classrooms that we have here. We attend classrooms in batches of 15 to 20. So it very beautifully accommodates all of us. This is a classroom happening right now. So here the classrooms are new and we always sit in batches of 15 to 20 max, and it accommodates most of us very beautifully. And we have the exam center right here, which accommodates people only up to 40. So, and it's supervised by CCTVs all the time. And we have our routine exams happening right now. So let's go and check it out. We start examinations on time and late coming is strictly prohibited. So we have face recognition cameras set up, and then after registering ourselves over here, we enter the examination center. It is CCTV supervised, and before we get in, we get to revise from here and also keep our belongings in the shelf room, in the safe room here, and then prepare for our exams. All of our exams are computerized and MCQ based, so we sit here, finish our MCQ exams, followed by OSCE or practicals upstairs in the simulation clinic. We also have our computer lab here, where we study modern IT technology, and a class is going on right now.
Where you want to insert footnote, go to references and choose insert footnote.
This is modern IT class happening right now, and we will be studying this in our first semester.
Code references, look.
Right. After we're done with our computerized exams here, we go to the simulation clinic to provide our practice. Hello, this is our university simulation clinic. We have several stations in which there is simulation, aka phantoms, where we get to practice practical knowledge and put ourselves into tests. So let's go in. Hello, Professor. This is Professor Archil Kapinadze, the director of the simulation clinic, and he'll be sharing a few words with us. Hello, Professor.
Thank you for your attention. We are in the simulation medicine clinic of University Geomedi, and we are trying to show the students the several medical tools and methods before they can reach patient, and after this they can reach patient more sophisticated and more easily. We can see several sides of our. Now also we have OSCE exams here, but we will try to see some. Here we have obstetrics class, and you can see this simulator.
Dr. MARINA PIRTSKHALAVA, obstetric gynecologist, MD, PhD, as associate professor. Today we have clinical skills in obstetric gynecology, and via this phantom we are able to perform physical exam of pregnant woman, and student as well is able to see not natural, but via this phantom is possible to see normal labor, abnormal labor as well, breech delivery, and different types of pathological condition of obstetrics.
So we saw right now is the obstetrics and gynecology department, where we were able to study what normal delivery, abnormal delivery, and also breeching looks like in the phantoms. So the main point of us having simulation clinics, and it's important for us to practice such procedures here, is so that in real life we're able to do it with more ease because we have already practiced it here in the phantoms. Similarly, we have other departments as well, and we'll take along. Yeah. Basically, to understand, we have models of the chest here in which the sounds of heart can be auscultated, and even the lungs. So lung auscultation and heart auscultation is done in these models of phantoms, and there are several variations of sound that we hear. Say for example, the vesicular breathing or the normal breathing followed by bronchial breathing and wheezing in asthma. So we're able to distinguish it by using the stethoscope on this phantoms. Similarly, just with the heart as well, we're able to understand the physiological sound as well as murmurs and arrhythmias. Over here we have the patient here with the full body of the patient, where we are able to do ECG examination. Is the BP simulator will be able to understand how to take or measure BP or blood pressure by this maneuver. So what we saw inside was the OSCE examination, where there's practicals, where we basically take a chit and then read what the question is and analyze the question, answer, and perform the procedure as well. So this is how we understand what procedures to do when we are actually put on spot. This is the manipulation room, and we have here different phantoms with, as you can see, burns and also cuts. So we get to perform suturing. We also get to perform examinations. Okay. As we can see here, we have the vaginal and male reproductive tract examinations. So we get to perform and manipulate on the patients before we get to do that in real life. So we simulate the entire process, starting from gaining consent to the hygiene procedures, to then giving a feedback review of what the examination was about, everything till from the very beginning to the end here.
So as we saw in gynae department, like students are practicing and giving the exam. So how many students comes in a one batch or one a group?
Right. So a batch would consist of around 100, but we are never here together. We always have batch-wise, and our timetables are specific for that. So at a time, only around 14 or 15 students will come maximum. So we get to participate and do that, and it'll be a 2-hour session. So everybody gets to do it by themselves as well, after the professor has performed it.
And what about viva and examination? It is one-to-one or in a batch of students?
It's always one-to-one. We get to perform, we go in, the heat is on, it's one-to-one just with you and the professor. You take a chit, you never know what you're gonna get, and then you're put on spot and you have to decide what to do.
And how long it will take, like 5 minutes or more than?
Right. So in each of the stations, we'll have multiple stations during our OSCE exams. So a minimum of 3 stations would be there. And then each station, we're given around 5 minutes. So 15 minutes for the practicals. And then we finish off our computer-based exam in the examination center.
Okay, that's great. Now we are with Dr. Archal of Geomedi State University. We'll discuss about the experience of him and the universities. So, hello, doctor. How are you?
Hello. I am working in University Geomedi until 2010. So I passed through several jobs. I was at the establishing of this department of simulation medicine, and we are trying to develop it time to time. My main job is radiology, but I also teaching the clinical skills, introduction to the clinical skills, and bioethics. And it is very interesting to talk with the students about the problems of bioethics, because it is the very wide social things, and because of this it is interesting how is developing their points of view. It is very interesting. University Geomedi is trying to develop, and we are developing in time. So we are planning to purchase for more phantoms and make more methods available to our students.
Okay. Thank you, doctor.